These are the steps of a portacatheter insertion through the jugular vein. To ensure accurate placement, the procedure is typically performed using real-time imaging guidance, such as ultrasound and X-rays. This allows the surgeon to visualize the internal structures and guide the catheter placement. Local anesthesia will be administered to numb the area where the portacatheter will be inserted. The surgeon will identify the internal jugular vein using the imaging guidance. A needle will be inserted through the skin and into the vein, and a guide wire will be threaded through the needle and into the vein. Using the guide wire as a guide, small dilating catheters will be threaded into the vein. The port reservoir placement site in the upper chest is injected with local anesthesia, and a 1-inch incision is made in a pocket formed under the skin. The port reservoir is inserted through this incision and positioned beneath the skin. The catheter is then tunneled under the skin from the port reservoir to a very small incision in the neck. A sheath is placed over the wire into the jugular vein. The catheter is fed through the sheath into the jugular vein and down into the large veins of the chest just above the heart, and the sheath is removed, leaving the catheter in the vein. The catheter is connected to the port reservoir and filled with solution that will prevent blood clots from forming in it. Then the incisions are closed with sutures or adhesive strips, and a sterile dressing is applied. The entire port reservoir and catheter is thus buried under the skin. When your doctor wants to infuse chemotherapy, they will access the port reservoir through the skin using a special needle.